Michael Corsillas here today. I want to talk to you today about snoring, sleepiness. If that's you, you need to listen to this. This is about sleep apnea. So, why you should be concerned. Sleep apnea is actually on the rise. There's more and more people who are having sleep apnea. What sleep apnea is, there's a term called obstructive sleep apnea. And what happens, the muscles in the soft palate, the back of the throat, just kind of relax when you're sleeping, and it just kind of closes that throat, and you stop breathing just for a millisecond. The body doesn't like that, the brain doesn't like that, so it forces the body to wake up just for a millisecond, and you go right back down to sleep. If that's happening all throughout the night, that's going to make you have lack of deep sleep. So some of the common symptoms of sleep apnea, and if you should be concerned, one is, of course, you're falling asleep at the wheel all the time. You're tired all day long. You have problems focusing because you're so dang tired. Some people wake up with a headache in the morning time. And some of the other symptoms, the common ones I'm seeing now, are weight gain, which has been linked with diabetes, hypertension, cardiovascular disease. So sleep apnea has been linked with heart issues and diabetes as well. A lot of people aren't aware that sleep apnea has also been linked with low testosterone and erection issues, and of course the weight gain. You don't want to gain that weight, so you got to make sure you don't have the sleep apnea going on. So how do you test for it? So what we do at our clinic, we usually send people home to do a home sleep study. It's a sleep study. You get hooked up to a couple devices, and you just go to sleep with those devices just to measure how much oxygen you're actually getting in, how much snoring you're having, and how much restlessness are you having. And of course, does that point to a type of sleep apnea going on? Now, if you do have sleep apnea, what do you do about it? You know, if weight's causing that apnea, which is a big common thing, if the weight gain is contributing to sleep apnea, you drop the pounds, and a lot of times sleep apnea will improve. A lot of people actually go on a CPAP machine. CPAP is a continuous positive airway pressure where you're on a device or a mask that's just breathing, or not breathing, it's blowing air into the airway to open it up, to keep it open. Because remember, sleep apnea is obstruction, where it's just closing it off. And so if you have that device on, it keeps it open so you can sleep deeply. You need to get that deep sleep. If you're lacking that deep sleep, you're not dreaming well, you're not healing well either. So it's very, very important to get that. So, you know, talk to your primary care provider, talk to us if you are interested in getting a sleep study, but that's the best thing to do. But I can't stress enough, if poor sleep or sleep apnea, if it's present, they definitely can contribute to weight gain. And where in our society, you know, 1 in 3 Americans are now obese, not overweight, they're obese. So it's definitely a good thing to rule out. So talk to your doc or your provider about a sleep study test. All right, hope this helps, and sweet dreams.